So it's a biomarker-driven treatment strategy-based phase 2 trial where we take the biological risk factors into account when we decide on treatment. So this is among the first times I think that in large B-cell lymphoma there has been a prospective attempt to do so. So we identified a list of factors. First one was the high-grade B-cell lymphomas, so BCL2 and MYC translocations, then BCL2 and MYC co-expression. Then there was also MYC translocation only, and CD5 positivity and P53 aberrations. In the beginning, all patients received the same therapy for the first 2 courses, and that was when the national pathologists were doing the pathology review and stratification according to the risk factors. And if the patients had biological risk factors that I just listed, then they received dose-adjusted EPOCH-R, whereas if they didn't have risk factors, they received R-CHOEP combined with etoposide in a biweekly fashion, which was how we did treat the patients in our previous trial. So we actually several things. The primary endpoint was to compare whether this biological consideration of these risk factors would somehow benefit the patients, and we actually first of all found excellent survival for all patients. And then what was a surprise to us was that if we then retrospectively analyzed the biological risk factors from our previous study and compared those, there was no difference. So the dose-adjusted EPOCH-R was not better than the biweekly R-CHOEP.